To start your day, we have a very convenient location for our physician parking right next to the hospital, and it's free.
The parking facilities at Lutheran are provider only and require badge access. In addition, if you need to use the facilities at Methodist, there's also provider parking that we have access to there.
The Iowa Lutheran cafeteria is open for breakfast, lunch, and dinner every day, 6 a.m. to 7:30 p.m. And of course, the most important amenity is coffee, which you can get there as well. The nice thing about the Lutheran Residency is that we have money loaded onto our badges throughout the year, and so we get free food while we're here.
Conference Room C is a dedicated didactic learning space. On Monday through Thursday mornings, we have an hour-long lecture, and on Wednesdays, we have a noon lecture as well.
Residents, faculty, and some specialists as well can come in to present. Fridays, we typically have off in the morning so that residents can sleep in.
We typically have table rounds in the morning where we sit down as a team and discuss each patient's case, and then we go on walking rounds where we see each patient with the attending physician.
Here at Iowa Lutheran Hospital, we get the opportunity to follow our own patients. So if you are a patient's PCP, when they're admitted to the hospital, you can follow them while they're here at the hospital to give them good continuity of care.
We also have one of the largest private psychiatry units that serves both adult, peds, and geriatric populations.
One of the really nice things about Lutheran is that we have an open ICU, so when our patient needs an up level of care, we can follow them in and not miss those learning opportunities.
At the basement of the hospital, we have a dedicated lounge for all the family medicine residents. In the lounge, there's a few computers for us to work on notes. There's also a phone that we can use to call consults, and then a few couches and a TV where we can kind of relax and hang out with other residents.
It's our place to, if we have some time to wind down and relax. It's right by the cafeteria if we're getting a snack. Often we'll eat lunch together there.
Our clinic serves a pretty diverse patient population, which is beneficial as a resident to get to see how a patient's cultural background can influence their healthcare experience. We offer different opportunities for translations in our clinic and in our hospitals. We have both video and phone interpreters available.
Our residency is fortunate to have a clinic that qualifies as a patient-centered medical home. This means we offer full spectrum outpatient medical and obstetrical care at the clinic.
Our clinic is unique in that we have several half days a week that are dedicated to different specialties. One morning of the week we're doing dermatology procedures, another morning is dedicated to gynecology procedures, and then 2 afternoons of the week we have dedicated to obstetric care.
We perform our obstetrical care at Iowa Methodist Medical Center. While we primarily work with our own family medicine faculty, we also have the opportunity to work with obstetricians who are in-house 24/7. This allows us to participate in higher risk labors and delivery. It allows us to participate in C-sections. We also have access to 24/7 backup with neonatologists, and we have a NICU here on site as well.
Really, I would say the reason that I'm here at Lutheran is because of the relationships that I could see forming, and that's something that I wanted to be a part of.